Hello again. In the last couple of videos, I discussed how to suspect HIV infection. So now that we've decided that we do need to test our patient for HIV, what kind of test do we use, when and why? How reliable are they? What is the difference between home point-of-care tests and laboratory-based tests? Depending on the test, there are three things that we can detect in the patient's blood. We can either detect the virus itself by detecting the viral RNA or the so-called P24 core antigen. In addition to that, we can detect the antibodies that the immune system produces in response to infection. So after the person first gets infected, in the first 1 to 2, but maybe up to 4 weeks, no test in the world will be able to tell you whether or not the person is infected, which makes sense because the virus simply needs time to replicate and to spread through the bloodstream to be detectable in the first place. So this first phase is called the eclipse phase because you are basically in the dark at this point. But after this initial phase has passed, our most sensitive tests will be able to detect the presence of the virus. The most sensitive tests that we have today are the ones that detect viral RNA. As the virus continues to replicate exponentially, after a few days, the tests that detect P24 antigen will become positive as well. And then, after a few weeks, the immune system will finally respond and start producing antibodies. Then it will need time to produce enough antibodies for us to be able to detect them. So the tests that detect only the antibodies are the last ones to become positive. It's worth pointing out that the antibodies will not be able to eliminate the virus completely, not by a long shot. Instead, around the time the antibodies appear, viremia will simply stop growing exponentially and it will actually drop from the peak that it reached in the acute phase, and it will reach a stable concentration that will remain more or less the same for the upcoming years. This is the so-called viral set point. And in this chronic stage of HIV infection, the antibodies will be present in high concentration. Viral RNA will be detectable as well. So in terms of testing, this chronic phase is basically no problem. The modern tests are highly sensitive, so whatever test you use, it should come back positive in this chronic stage of infection. But the acute stage can cause false negatives because, as you can see, every test has its window period, so if we use a certain test too early, we are likely to get a false negative. This is why today the guidelines recommend that we use the following approach to HIV testing. As the screening test, we should use a 4th generation test, meaning the one that will detect both the P24 antigen and the antibodies. If either one of these two is positive, the test will come back positive. But since HIV is no trivial diagnosis, whenever this initial test comes back positive, we want to use another confirmatory test, which is usually antibody-based. And most of the time, these two tests will be in accordance with one another. However, exceptions can happen. It can happen that the initial test is positive, then the confirmatory test comes back negative. What do you do then? Well, the first test could have been a false positive. This is very rare, but it can happen. Our modern tests are highly sensitive, highly specific, very close to 100%, over 99% sensitive and specific, but exceptions can happen, so okay, this is the possibility number one. Number two, the second antibody test is negative because there are no antibodies to detect yet. In other words, the initial test detected the P24 antigen, and this is why it came back positive, while the confirmatory test came back negative because there are no antibodies yet. In other words, we detected an acute HIV infection. So how do we resolve this dilemma? Depending on the availability of tests and your local guidelines, you can either repeat the test later at a time when the antibodies should be positive, or you can simply order PCR if it is available. If the first test is truly positive, if there is P24 antigen present in the blood, then PCR should definitely come back positive, because remember, PCR is more sensitive than the antigen test. In medicine in general, the tests that detect the genetic material are more sensitive than antigen tests. Okay, but now you might ask, Why even bother with P24 and the antibodies? Why didn't we use PCR right away? Well, PCR is not widely available, it's very expensive, it requires specialized equipment and specialized personnel, and while it is absolutely essential in early HIV infection, when it might be the only test that comes back positive, there are still situations where PCR might be negative and only antibody tests will come back positive. For example, in patients with chronic HIV infection, if they are on effective antiretroviral therapy, viremia can be suppressed to undetectable levels. Meaning PCR is invaluable, but it cannot completely replace antibody testing. Okay, so much about laboratory-based tests. Let's turn our attention to point-of-care tests that anyone can use at home. The ones that are on the market right now work in a way that you either apply a drop of capillary blood to the testing kit or you swab the patient's oral mucosa. You follow simple instructions, apply the test fluid, and you have the results in less than 20 minutes. Obviously, this in itself is great. The tests are affordable, widely available, portable, and you get the results practically immediately. And they are highly sensitive and specific. Most of the studies agree that these tests are well above 90% sensitive. Some even say 99% sensitive for some tests. Of course, there is variability because there are different tests out there, but again, they should be very reliable for chronic HIV infection. Again, I emphasize chronic HIV infection. Once again, the acute infection poses a diagnostic challenge because most of these tests are actually second or third generation tests, meaning they only detect the antibodies, not the P24 antigen. And by now you understand why this is not perfect. Which brings me to the final point of this lecture. When you look up various tests online and you want to know when should they become positive, at which point after infection, you will see that this time to positivity is expressed in days or weeks. So for example, PCR should become positive about 10 to 15 days after exposure, after the person gets infected. A fourth generation test will be positive within 15 to 20 days, and the third generation test that detects only the antibodies will be positive within 20 to 30 days. So this seems to be in accordance with everything that we covered in the first part of this lecture. But keep in mind that this is the median time to positivity, which means a little more than 50% of positive patients will become positive within this time frame, which in turn means that many patients who actually are infected will not be positive yet at this point, right? So if you want to exclude HIV infection, you don't want to know when 50 or 70% of patients should be positive with a certain test. You want to know when close to 100% of them should be positive if they actually are infected. And then you will see that for PCR, this is about 30 days after infection, quite a bit longer than 10 to 15, right? For a fourth generation test, this is about 45 days, and for a third generation test, it's up to 90 days. So just to be sure, you need to wait 90 days and then retest the patient with the third generation test. And this is why most guidelines recommend that if your patient is negative right now, but they had a high-risk exposure, or you have a good reason to believe that they are actually infected, but the initial test came back negative, you should retest them in 6 weeks, 3 months, sometimes even 6 months, depending on the test in question. So at first, this might seem excessive, this very long time period, but now that you understand the limitations of tests and the natural progression of HIV infection, I hope that these recommendations make a lot more sense. Thank you for watching. If you feel that you learned something, please share this video with your colleagues and students. I feel that this will really help them in practice. This is why I make these videos. Don't forget to subscribe. Thank you for watching. Good luck out there and take care.